I'm happy to announce today that for the 2020 UN Public Service Awards, we are recognizing initiatives from 7 countries. They are Bangladesh, Botswana, Brazil, Mexico, Republic of Korea, Spain, and Portugal. The initiatives by institutions and public servants in these countries, from using technology to enhance education and social service provision, to providing more robust community-based healthcare for elder populations, have helped advance sustainable development goals. But this is not all. They will better prepare us to respond to crises such as the COVID-19 pandemic in the future. I congratulate all the winning institutions and the public servants who have brought these initiatives to life. I encourage those watching to learn more about them on the UN website. To close, I wish to extend the profound thank you to public servants globally for the work you have done and continue to do in keeping us safe during this challenging time. Now is the time for us.
Deadly COVID-19 pandemic, public servants have been on the front lines of the crisis response. They are the nurses, doctors, and paramedics who provide life-saving care, the sanitation workers who disinfect and clean public spaces, the transportation workers who keep buses and trains running, the teachers who educate our children both on and offline, and the public health officials, data managers, and statisticians who provide vital and reliable information on the transmission and prevention of the disease. Many of these dedicated individuals have carried out their work in dangerous conditions, with high human interaction and without access to personal protective equipment. And some have lost their lives to COVID-19 in the process. Today, as we honor these essential workers and so many more, we must also reflect on how to better protect, recognize, and invest in their well-being as we build back better together. And I say directly to these inspiring public servants, we are all deeply indebted to you for your remarkable acts of service to humankind.
Making this important day, we are marking, rather, this important day in the midst of an unparalleled global crisis, which has substantially disrupted the work and functions of the public service, but not only. This crisis requires that civil servants adapt to the changing realities of our time and adjust their service delivery to ensure continuity while reducing the impact of the COVID-19 pandemic. And continuity of public services is even more vital today than ever before, now that we are relying on our civil servants to give us reliable information, guidance, and services in these most challenging of times. The overwhelming burden of this pandemic has fallen on the shoulders of the devoted public servants in the health sector. These public servants have been working while putting their lives in danger. Many have been exposed to the virus while continuing to provide essential services, and some have even lost their precious lives. As we mark the UN Public Service Day, we should honor the selfless service and sacrifice of our public servants who have made a real difference in the lives of people in this moment of global crisis. The best way to honor their sacrifice is by devising ways to better protect public servants as they continue to provide essential services under the life-threatening circumstances. In our interconnected 21st century world, technology has made it much easier for individuals.
Overseas entrance, we have transparently disclosed such epidemiological data to the public, which include the number of confirmed cases and their routes. The Koreans also wear masks as a daily routine and actively participated in social distancing. In addition, massive testing enabled us to find confirmed patients at an early stage and trace their movements. Confirmed patients were then quarantined for proper treatment. With the principles and strategies, it was the dedication of healthcare professionals and high degree of civil awareness and participation that played a pivotal role in pandemic response. Also, public services offered by the central and local government, as well as close civil and public cooperation, laid an important groundwork. From the outset, the Central Disaster and Safety Countermeasure.
In the last few months, we have seen an outpouring of gratitude for the service and sacrifice of health and social care workers. Public service workers are being celebrated in capitals, cities, and towns across the world. It's right to applaud, acknowledge, and celebrate. But I would also like to ask how we're acting upon information, what's that we're doing for others. COVID-19 is not going away. To the contrary, the pandemic is growing. The number of cases and deaths continues to rise. Last month, leaders from all over the world came together to launch the Access to COVID-19 Tools Accelerator or ACT Accelerator to hasten the development, production, and equitable distribution of vaccines, diagnostics, and therapeutics. The true measure of success will not only be how fast we can develop safe and effective tools, it will be how equally we can distribute.